Welcome back, everyone. My name is Heidi Illingworth, and as the MC for the conference, it's my pleasure to welcome you this afternoon to CMNCP's final keynote panel focusing on what we can learn from COVID-19 in the context of community safety. Jan Fox, the board co-chair of the Canadian Municipal Network on Crime Prevention, will now say a few words. Over to you, Jen.
Oh, thank you. Thanks so much. And thanks. Welcome back, everyone. I really want to say a special thank you to you, Heidi. You have just been amazing, a trooper. You've worked with us through this whole thing. And so let me just talk about today's agenda. I had the good fortune on Monday of welcoming our gold sponsor, Matthew Swarney, who has been for a long time a great friend to this network. And I'm going to be able to welcome him back on behalf of Motorola Solutions in just a few moments. And after that, you're going to hear 4 very different perspectives on what we can learn from COVID-19 in relation to community safety and such an important topic. Today's panelists include a diverse group of presenters, including the Peel Region Chief of Police, Nishan, and I'm going to take what he always gives me a pass and says I don't have to pronounce his last name. So thank you for that, Nish. Also an incredible supporter and friend of the Canadian Municipal Network and someone who's a real visionary in policing. So we're so fortunate to have you here today. And from here in Treaty 6, where I'm joining you, Treaty 6 in Métis Region 4, we have the President and Chancellor of MacEwan University, Dr. Annette Trimby. I'm so glad that she's able to present here today. And I'm hoping that she'll talk a little bit about her work in academia, but also that she chaired a very, very important task force here in Edmonton on community safety and well-being this past year. So she's going to be a wonderful addition to the panel. And Roxanne, who I've just met from Laurier's University Weizmann Center for Engagement and Research and Sustainability. And I'm so grateful that you are able to be here with us today. And the Executive Director, Erica Bodwin from Regina Treaty Status Indian Services. So very, very excited about that. This panel will be great. Please welcome Matthew Swarney, Director of Government Affairs at Motorola Solutions once again. And I can't thank you enough for your sponsorship. I hope that you have seen that this was a really worthwhile endeavor because it's been well attended and just great presenters. So thank you, Matthew.
Absolutely. And thank you, Jan, and good morning and good afternoon, everyone. I'm speaking with you today from the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. I would like to again thank the CMNCP for the privilege of sponsoring this year's conference. And again, to thank Jan and Felix in particular for their friendship and guidance. Je suis très reconnaissant de l'amitié de Jan et Felix. My closing remarks are very similar to my opening remarks, if for no other reason than to remind myself of the imperative and amazing opportunity for all of us for the future following what we have heard and discussed at this year's conference. That being the imperative to ground ourselves firmly in the experience of those experiencing the greatest amount of harm, marginalization, and victimization. We need to hear from and listen authentically to those voices and experiences, something we have collectively not done at all or done very well up to now. And then to have those voices guide us to a better experience for all of us. Do more voices make the path to a better experience for all of us more complex, tricky, and at times uncomfortable? You bet they do. But I would much rather take a complex, tricky, and at times uncomfortable path to a better future for all than an easy and predictable path to a less than desired present. I am also very confident that if done the right way, that complex, tricky, and at times uncomfortable journey in some ways can be the destination of a positive social environment, of a helping hand, and a friendly face, to borrow again from the editors of the World Happiness Report. An environment that will be the fuel to spread the positive outcomes we all so much want to happen in communities across the country. I'll close by thanking you all again And as I also mentioned in my opening remarks, I look forward to meeting you all in person when the conditions allow. Back to you, Heidi.
Thank you so much, Matthew. We appreciate so much the sponsorship and longtime support. And it's now my pleasure to introduce Juma Asiago from UN Habitat to provide a brief welcome address to us all from an international perspective. Juma Asiago is an urbanist and social scientist and is the global coordinator of the Safer Cities program at UN Habitat. Part of his many achievements has been the development of the Global Network on Safer Cities, the GNSC, the development and adoption of UN system-wide guidelines on safer cities and human settlements, and the realization of several municipal crime prevention and safety strategies globally. Juma, over to you.
Thank you very much. And thank you very much to the Canadian Municipal Network on Crime Prevention for inviting UN Habitat to join you all in this very interesting conference at a time when community safety worldwide is confronted by the global challenges of the COVID-19 pandemic. Very well to say that COVID-19 has shown us the importance of prevention, evidence, and our ability to transform our policies quickly. Unfortunately, it has added urgency to tackling the causes of violence against women and children. And as we can see, experts worldwide are now showing us how affordable and popular actions now will prevent annually hundreds of thousands of homicides, millions of women from intimate partner and sexual violence, and millions of young people from victims of violence. UN Habitat has, over the past 2 to 3 decades, promoted the importance of the role of local governments, the role of cities in the prevention of crime and violence. We started way back in the 80s advocating for the idea that safety is not just a police alone responsibility. It did not belong to the criminal justice system alone. And we needed to look more into the upstream causes of crime and violence, many of which in terms of mandate lay within the realm of local government. This far, we have cities around the world, in Africa, in America, in Asia Pacific, in the Middle East, that can now demonstrate what works and what does not work in terms of prevention policies to reduce crime and violence worldwide. And this led to governments in 2019 adopting UN system-wide guidelines on safer cities and human settlements, acknowledging the principles and approaches that have worked and that require now to be part of the integrated solutions that the 2030 Agenda for Sustainable Development are highlighting in terms of sustainability of cities and towns. It is not lost to many that the SDG 11 now captures safety as one of the key precepts of cities and how to make cities safe and sustainable and inclusive and resilient. The practices of municipalities over the past 2 to 3 decades have contributed to governments, national governments, acknowledging the importance of the city as really the centerpiece for how prevention and how safety in cities is, safety in countries is actually going to be achieved. UN Habitat has looked up to Canada from the inception, and I really wish to acknowledge the role of the Emeritus Professor Arvin Wala, who was part of the founding fathers of the Safer Cities program at UN Habitat, and in this particular dimension has led the efforts around the world to help cities receive the technical assistance and support with the tools that work or that now can be proven to work in terms of preventing and reducing crime and violence. The Canadian experiences are for the international community a real asset And we look up to Canada in terms of the municipal experiences to guide the implementation of the 2030 Agenda for Sustainable Development and the new urban agenda in as far as how prevention is understood at the municipal level. We count on Canada also to guide us in the next steps as we build better measurement and monitoring systems for cities to the year 2030 to ensure that we are able to measure the impact of our work. And we think that documentation of the experiences that Canada has availed to the international community will help many countries not just simply go back to the same old interventions that have proven not to work. We now have the evidence of what works. And Canada is indeed, for the UN community, an international lead in these dimensions. We call you to join us in these actions towards making cities safer by participating in a global partnership initiative in ways where we could peer review each other's experiences and see what has worked in Latin America that has not worked in Canada, what has worked in Canada that has not worked in Latin America, and so on and so forth with other regions of the world. UN Habitat, as the convener of best practices for cities, is willing to accompany you in this particular worthwhile endeavor. The United Nations recognizes that what works is essentially an important dimension for us to build on to get to the integrated solutions that the 2030 Agenda for Sustainable Development is calling for. We need to look at cities as laboratories of knowledge, of learning, of innovation, and of integrated solutions. I would like to close by emphasizing the importance of evaluation in our work. And I hope that in the coming months, we will see Canada taking the position of leading this peer review process for countries, not only between countries, but also within the country amongst municipalities, to bring forth the quality, the improvement in the quality and consistency of municipal policies and programming. UN Habitat is offering an urban safety monitor tool as a way to take this work forward. And I hope to see many of your municipalities joining this global effort in the coming few months. This month is the Urban October month. It is the month where the 40 Days Safer Cities Challenge is taking place. We are urging countries to actually demonstrate what works and highlight this to the global community. We thank Canada for having participated in the first session last year and hope that this year we will see Canada also being looked at by the international community through conferences such as this and the results of conferences such as this that can actually form an international conversation, debate, and discussion about the important role cities can play in preventing crime and violence. There is a lot more work that needs to be done in terms of decentralizing security policies from national governments. We think that the new urban agenda offers those solutions where municipalities can receive better financing and also achieve better ways of how to use planning and legislation to really improve prevention and to institutionalize prevention at the local level. I thank you all.
Thank you so much, Juma, for your presentation and for bringing us that international perspective. All of your work at UN Habitat is so critical to advancing the 2030 Sustainable Development Goals, and we absolutely need to do more. So I'm glad to hear about that you guys are building better measurement and monitoring systems for cities, because the evaluation of the programs and what works, that we need to show that how we're implementing that. And I love the idea of peer review as well between countries and with municipalities doing that with each other as well. So thank you so much for being here and sharing with us all of the important work that you're doing. And now it gives me great pleasure to welcome our panelists for the final keynote panel exploring what we can learn from COVID-19 with regards to community safety. So the keynote panelists are Chief Nishan Juriappa from Peel Region in Ontario. We have Dr. Annette Trimby, the President and Vice Chancellor of MacEwan University. We have Dr. Roxanne Springer from the Weissman Center for Engagement and Research in Sustainability at Laurier University. And last but not least, Erica Baudin, Executive Director of the Regina Treaty Status Indian Services. So rather than reading all of their biographies to you, I would encourage you to just have a look at the program handout. We wanted to take the time to spend with the panelists and hear from them. And then following this, each of our panelists are going to present for approximately 15 minutes. And then that's going to leave us about 30 minutes at the end for a group discussion and questions. So we will allow the presenters to make their presentations, and then we will have participants, conference participants, please submit your questions through the chat function, and we will monitor those and bring them forward at the end to the panelists. So I would now like to ask Chief Nish to speak for 15 minutes, and we've asked him to address what police and policing can learn from COVID-19 with regards to community safety. Over to you, Chief.
Thank you, Heidi, for the introduction, and good day, everybody. And again, it's my pleasure just to add some context to this broad discussion on learning points as it pertains to community safety during a pandemic. So I just wanted to start with first of all, I'm in Peel Region, which is just outside, just west of Toronto. We represent a community of 1.5 million residents. I'm also responsible for Toronto Pearson Airport, which is actually in Peel Region. And so a very urban environment, dense and diverse community, very appreciative to be here. And just want to say that my experiences may not be the same as all chiefs, but I put this visual up here because I think, not only has the pandemic changed how we deliver services to the community or serve the community, it has transformed how we have looked at innovation. In many cases, we've had to close police stations at its worst and augment how we see, delivering services to people who just need, from the most basic interactions with policing to the most serious ones, how that looks. And so not only has it impacted our people, it has really brought forward a platform for us to be far more innovative, perhaps something that might have taken us much longer to achieve should it have been non-pandemic. Andrea, can you get the next slide too, please? So I also want to, show you this slide here because post George Floyd, this was the geopolitical environment that was concurrent to the pandemic. And these are all photos from my region. Rightfully so, our community, really had a opportunity to, speak publicly, to be out. Some of the protests that ensued required human services in multiple systems, including our municipalities, and very specifically policing, to do a lot of listening. And the reason I show this to you is this is concurrent to the pandemic. So when we think about what does community safety look like during a pandemic, it wasn't just a health paradigm. It was a confluence of a variety of issues which all spoke to the failure of systems, or in fact, the opportunity for systems to be better coordinated in order to better serve our community. Andrew, you can take that slide down. I just wanted to use that visual. So what I wanted to say is the value of that slide speaks to some of the complexities as it pertains to community safety. I need to say that we can't and we shouldn't operate as business as usual. And I think for policing, that was our aha moment. Deep systemic and sectoral change that's needed, in the cases of COVID-19 or systemic discrimination, really came to the forefront. And the pandemic highlighted many societal disparities that require better policing response, but better partnerships within my sector, various levels of government, community stakeholders, and other human services. So what came to the forefront is we learned to explore partnerships and collaborations in a more rapid and emergent way so that we could better share resources to work efficiently and transform a modern traditional approach to more modern approach. And, I think we'll have other panelists here that will probably speak to it. I am a significant advocate for the community safety well-being model, which, is an evidence-based and leverages data, best practices, and research, but says we in policing can't just operate at emergency response. We have to look at opportunities to mitigate risk, prevention, and social development, and not do any of those things on our own. So as police organizations, we have long known that many of our resources being deployed to issues to do crime and public emergencies are far more complex. And that's what came to the forefront during the pandemic for me as a chief. The issues such as mental health, addictions, domestic violence, intimate partner violence, homelessness, food insecurity, older adult isolation, youth-related issues, all came to the doorstep of policing in a far more acute way. I can tell you that in Peel Region, from January to July of this year alone, my officers have spent nearly 29,000 hours on mental health calls. That represents probably about 7,000 mental health events a year. And these are just numbers that scratch the surface. And I think what the public has seen is this awakening that perhaps we're not always the most appropriate people to be at the doorstep of some of these issues. Clearly, we need to be there when there is risk to public safety, but the underlying mental health issues and that are social related issues that are byproduct of many complex issues that end up on our doorstep have drawn attention to us needing to change. And I'll just use the example of the defund police movement. Apart and aside, clearly my opinion would be that turning the tap off on policing and simultaneously turning the tap off on up on other systems is maybe impractical. But I think what we heard from the public is, can we strengthen other human services so there's less reliance on policing for some of our community's ills? And I need to agree with that, is that, and reorient the discussion to coordinated systems level multi-sector responses to community safety. And in Peel Region, we have a highly diverse community. I think it is a very well known that COVID-19 as a pandemic exacerbated mental health, economic, and social burdens in our community. While we're cautiously optimistic that we're moving out of it, as a police service, we have seen a lot of these issues come to the forefront. An example is, Children's Hospital has reported that more than 70% of children between the ages of 6 to 18 have experienced some level of deterioration with their mental health during the pandemic. And if you add to the fact that they had a less ability to be connected to supports, teachers, those in the community, their coaches, people outside of their house, and their vulnerability was accentuated by their isolation, we know that the impacts are tremendous. My officers see that regularly. So what's the takeaway for policing and public safety? It only affirms the fact that community safety and well-being more than ever needs to be the cornerstone of how we move forward. So, the key message is the police services are already overextended by issues that are fundamentally non-criminal in nature. And the pandemic created the need to, kind of double down on CSWB, as Juma had mentioned, to get upstream in a risk-driven model. And I know that many organizations and municipalities have applied that. Some of the things we've done is shift in the same calendar year of the pandemic, is deconstructed our policing model and put an effort into having officers that have no call response function, but are simply there to meet vulnerable populations and support individuals experiencing crisis and try to connect them to services in an upstream approach. So one of the things we've done in Peel Region is also built a community safety well-being plan that we have with our municipalities, but also our own companion strategy, which drives how we approach a variety of different issues. And I'm not talking about being soft on crime, but ensuring that we mitigate harm in our community. And a couple of quick examples of that are, for example, family and intimate partner violence. Despite seeing a reduction in crime severity right across this country, violent crime did drop a little, but we know that intimate partner and domestic violence rates continued to rise, but continued unreported behind closed doors because the vulnerability and isolation compounded things. So what we have done is have to adjust to a more trauma-informed approach. And within this last year, created a 50-person intimate partner violence team. And that's not new for policing, to have individuals that specifically respond or investigate intimate partner violence. But what we did was embed them in Peel Safe Center, which is a wraparound community center with 15 other agencies, to shift response to support, and in a hope that we can help survivors connect to services right away. In a span of 2 months of this model, we committed 200 referrals to community service agencies at this Safe Center. And for example, that surpassed the number of total referrals to agencies the entire calendar year last year. But what this represents is a change in a trauma-informed approach to public safety. The same thing with mental health and addictions. It is very common for officers to bring crisis workers with them so that they better serve the public, but we're also looking at embedding crisis workers in our communication center. So right upon inquiry coming in from the public, or a call, emergency call, to have a crisis worker perhaps triage a more appropriate response to connection to services that may not require a uniformed officer there. We know that sometimes they are the best people to be at the doorstep, but quite often we shouldn't be there. And I am a proponent that that's a flexibility that needs to happen. Another big issue, I think municipalities see this all the time, that we saw during the pandemic, was road safety. And I think if we have any municipal or elected officials here, they probably continued to hear feedback that people took advantage of less people out and about on the roads, and mobility still continued despite the fact of the pandemic. And so, for example, we had roughly 30 road fatalities in Peel Region last year, and this year about 25 year to date. But we know a lot of the behaviors that are stunt driving, impaired driving, are ones which could be mitigated. And so we've applied that community safety well-being model to this as well. For example, my officers, should they deal with an impaired driver, are providing referral to Peel Addiction Assessment and Referral Center right at the curbside. They will concurrently move through the court process, but what we're trying to do is mitigate the next time they get behind a wheel. So, these are issues that we really saw come to the forefront. And just before I finish, the last piece I want to say is that I showed you the picture of all the protests that we've seen. And that speaks to the need for acknowledgement from those that are working in human services to acknowledge that systemic discrimination occurs across all human services. And as a chief, it's my responsibility to own my sector. But a shift to a pro-human rights lens, to not see policing as proprietary, is much needed. And one of the things we've done is embark on a human rights initiative, which includes understanding how certain communities are disproportionately affected by either contact with the police or health. And this is a significant initiative that we've taken on. As I wrap up, I just want to say that the pandemic has presented many challenges, but there are also opportunities to examine our service delivery and the needs of the community. I think one of the lessons known is we all have to, inclusive of municipalities, policing, other human services, to not see our traditional roles in the way we did, to not see our function as proprietary, but to look at non-traditional ways. And I think many provinces have seen police be used to, support the health narrative. And I think there's an appropriate way to do that without, perhaps the traditional way of doing things. So as I wrap up, I just want to close off with the notion that we need to listen to the needs of our community and adapt to provide better service. And if we do these things, we can close the book on people pointing out the gaps of the past, and as we look to close the gaps for the future. Thank you, Heidi.
Thank you, Chief, so much for your remarks. Really appreciate your point of view and hearing about a human rights approach to policing, and that you're really listening to community and the needs, and really interested in providing better service, recognizing that there's perhaps other human services and partners, community level partners, that can provide what the community needs in terms of, mental health response and other situations like addictions and things like that. So thank you so much. Next on our panel, I'm going to invite Dr. Annette Trimby to speak to you for 15 minutes. And we've asked Dr. Trimby to speak to the role of educational institutions. Over to you, Annette.
Thank you, and it's great to be following the last presentation. So I did send you some slides, so I wonder if you can pop them up. All right. So good afternoon, everybody. It's just about lunchtime here in Edmonton, in Alberta, on Treaty 6 territory. My name's Annette Trimby, and my academic field is aquatic ecology, and I used to spend a lot of time studying the impacts of perturbations on ecosystems. So if you think about it, this pandemic is a perturbation of a magnitude that I have not seen before in my lifetime. So for all of us, these are very interesting times to lead. And I left the University of Winnipeg right at the start of the pandemic and arrived at MacEwan University in August. So in Alberta, we talk a little bit about a triple pandemic. So there was COVID-19, lots of concerns about social inequities, and also an economy that's going through a rapid transition. So the role of a university president, just like pretty much every other leader, is to absorb chaos, portray calm, and convey hope. And the role of a university is to teach, research, and serve the public good. So these are interesting times with many intersecting crises. We are all reeling at the news of the unmarked graves of students that had to go to residential school. We've this summer read the most recent IPCC report on climate change, and so many vulnerabilities. And those of you that work in the field of emergency operations know that often you're dealing with the symptoms of problems that are far deeper than that. So when I started at MacEwan University, part of what you do when you come, in my case, I was coming back to a community that I had spent many years in, is you look to do something of value. So one of the things I was asked to do was to be the chair of a task force set up by the city of Edmonton to look at community safety and well-being. And as the chief talked about, our cities have changed in response to COVID, and we are seeing a lot more of these issues come to the top of our priority lens. So let's talk a little bit about the next slide. So in this task force that I was asked to chair, it was this really innovative approach, because what the city did was they created a task force with 1/3 of the people having had lived experiences. 1/3 of the task force were members that would be viewed as experts in racism, equity, diversity, inclusion. And 1/3 of the task force included members of the police service, members of the Edmonton Police Commission. So that in itself was quite interesting. And obviously, we very quickly noted that safety is about more than crime statistics. And I think we just heard about the complexities of that. So one of the first things we did in the next slide is we wanted to define what community safety meant. More than crime statistics, community safety should provide a sense of belonging. It welcomes, values, and includes individuals of all backgrounds and circumstances, enables people to live without fear of being harmed, targeted, or othered, allows people to engage and participate in community, and supports people and families in overcoming homelessness, poverty, addictions, and other challenges, treats all individuals with respect and dignity, and treats all individuals equal under the law. So we came up with a report, and we had 14 recommendations, and they were clustered into these baskets. Send the most appropriate responders. And we've already heard that in many instances, the police are called to situations where they would be the first to admit they're not necessarily equipped for those situations. Obviously, some ideas around how to modernize how people respond, some issues around trust. And as with other cities, we had to answer questions about funding for police. And at the end of the day, we suggested that perhaps some of the increases needed to be reinvested. And so this was an interesting return to Edmonton for me. And I was pleased to see the Edmonton City Council accept 13 of the 14 recommendations with a little bit more work to do. So why do I raise this? I raised this because I knew it would fit into the last conversation, and because I do believe the role of universities is to be in the mix and to get involved in community. So next slide, just a little bit about the MacEwan, the university I currently lead, MacEwan University. We are turning 50 this year. We were 40 years as a college, so we're a relatively new university. We are downtown. Our campus covers 7 city blocks, and before COVID, we would bring 20,000 people downtown a day, and there are 65,000 people working downtown. So we are a substantive participant in Edmonton's downtown. I like to say, don't just think of us as consumers coming downtown to spend money, or as an anchor tenant, because anchor sounds like we are bogging the city down. Instead, think of universities as a place with lots of energy, ideas, places where collaboration happens, and there is a sense of vibrancy. So the graduates that come out of MacEwan tend to stick around in the province, and we're everywhere: nursing, community health, the arts, business, and tech. So we have about 80,000 grads, and 87% of them live in Alberta, and our students learn in a very practical way. We view ourselves as a living laboratory. We have lots of practicums, work integrated learning, experiential learning. So next slide. The previous speaker talked about how innovative we have all been through the pandemic. And I think it's fair to say that universities really did deliver in the pandemic. Universities quickly pivoted 1.4 million learners to online learning in March 2020. Universities advanced vital rapid research related to COVID. Universities are seen as stabilizers in community. Universities kept students safe, provided quality education. And I believe universities are seen as beacons of hope for individuals and for communities. We provide talent, we provide solutions, and in many ways, we are a source of ideas and a source of those very disruptions that we like to talk about, whether our students are ready for, with respect to future proofing and so on. Next slide. But as we all know, the pandemic also highlighted the inequities in this country and exacerbated existing challenges. And I think Erica's probably going to talk a little bit about that in her talk. So for Indigenous learners, we are worried about the gap. And in the words of Regional Chief Marlene Potras of the AFN, she noted that she noted this very point. And Inspire, who does a lot of work to help Indigenous students across the country, have been doing surveys. And as the chief noted, mental health strain is going to be another wave of the pandemic. We all know that. MacEwan University and the university I was at before feel pretty good about including and expanding our numbers of Indigenous learners and seeing increases in graduation. So like every other university in Canada, we believe we have an incredible role to play with respond to the Truth and Reconciliation Commission's call to actions. Next slide. The choices we've made, we very much kept the students front and center. And one of the things that I was just on a call this morning where people are talking about whether place matters anymore and whether the future is to do everything online. And truth be told, we really miss human interaction, and our students really do want to be on campus, and we are learning how to leverage the technology. And in some ways, the technology allows us to increase access. It allows us to be much more flexible. And that is the case if indeed our students have access to the internet and have access to a place to work. What I'm finding is our students like to be on campus. They like to be in the library, even if they have several classes online. We make very thoughtful choices, and we know that the student experience very much depends on a feeling of belonging. And this can happen face-to-face, but this can also happen with technology if you're thoughtful about how you do things. For example, we've been able to reach more students with counseling and mental health services in part by leveraging the technology. So next slide. Place does matter because place informs what you research, what you teach, and really how you serve the public. There's a porosity to downtown universities. We position ourselves within community to connect our students and faculty to grapple with social, public, business, and policy challenges. And it's this collision of ideas that sparks innovation. So we do see ourselves as a living lab, and it's important to be connected with community. Next slide. So what happens when you go to a new university is usually the first thing that's put in front of you is to think about the next 10 years and to develop a strategic plan. In Alberta, the province had just done a review of the entire system called Alberta 2030. And so it was an opportunity for MacEwan to really position itself in the post-secondary ecosystem. So I'm sharing with you our 5 strategic directions, but I'll just cut to the chase and say that we are a school that highly values that very first transformative undergraduate learning experience. And we really want to look at meeting the students where they are at with their learning and do more in the summer, do more in the evenings, speed things up, allow students to come, go, come back, and really meet the students where they're at and really think of a university calendar in a very different way. We also acknowledge that the future of work is very different for our students, and we need to prepare them to be nimble and to adapt. I like to talk about durable skills in addition to job skills. Durable skills are things like critical thinking, analytical skills, cultural competencies. And like other universities, we are aware that there's a growing demand for post-secondary. We need to grow smart. And like other universities, we know that we do scholarly work, research work that is impactful in our communities, and we need to share that. It's not enough to just publish in journals. Next slide. So we think about the next 10 years, and we think about the important role universities play in the public good, and we think of all of the challenges coming our way. I think it's important to be hopeful. COVID has accelerated all trends in post-secondary. We do know, I know when I talk to elders, they talk about education as the new buffalo. Education transforms lives, transforms communities. We build solutions. So most of our students are in their defining decade. I've learned that the 20s have been coined as the defining decade for individuals. And dare I say, I think this next 10 years is the defining decade for all of us. So again, it's not enough to just hope. Hope is not a strategy. And I'm not talking about hiding in the sand. I've been reading a book written by Thomas Homer Dixon called Commanding Hope. And he speaks to the importance of shifting our mind away from hoping that somebody fixes something for us, to hoping to, which is a much more active way of thinking about our future and thinking about our role in the future. And I think there is a lot of uncertainty about the future. And so I think sustaining hope is still an honest thing to do. And I do believe universities are key to safe, resilient, healthy communities, in part because we teach, research, and serve the public good. We have a very critical role to play in recovery. We have a very important convening function. We do develop social infrastructure. And we as a community of universities are definitely interested in playing a role in building back better, or whatever phrase you want to use. We know that, there are many things we need to change, and there are many things that we have surprised ourselves with how rapidly we are capable of changing them when it's necessary to do so. If there is tension around the role of universities going forward with respect to the public good and social infrastructure, it's really a tension around who decides what the public good is. We are funded primarily by the province, by student tuition. Cities tend to love us. The federal government, doesn't matter who's in power, they tend to fund a lot of the fun things we do. But at the end of the day, it comes down to who gets to decide what the public good is. My personal view is that downtowns are not dead. They will change. They will be more diverse. They will be more inclusive. They will be more edgy. They will be more interesting. And every challenge manifested by the pandemic is even more acute downtown. So I'm looking forward to a conversation that we're all going to have. And, like every other person on the call, like I think in terms of possible scenarios, and I like to get ready for those scenarios. Again, I don't think the fear of density is going to mean the lights are going to go out downtown. I certainly don't think things are going to stay the same. I think we are talking about a revolution, or we are talking about transformation. But at the same time, I'm one of those people that believes you achieve that through steps that people can understand and are willing to work with you on. So it's all about creating a shared vision of the future, developing goals, and engaging people in working towards those goals. So thank you very much. And I think I used my 15 minutes to the max. Thanks.
Thank you so much, Dr. Trimby, for your very inspiring message. And we appreciate all the work that MacEwan has done to be innovative during the pandemic, and obviously how connected you are to the downtown community there, and all the work that you're doing to ensure that students in their 20s and doing their undergrad are, part of that teaching, research, and serving the public good environment that you're creating there. And so that's just amazing. And thank you so, so much. And we'll look forward to asking you questions at the end of the panel. So now I would like to ask Dr. Roxanne Springer to speak for 15 minutes. And we asked Dr. Springer to illustrate how climate change adaptation, more specifically planning for climate change emergencies at the local level, can benefit from a review of the impacts of COVID-19. So over to you, Doctor.
Thank you, Heidi. Good day, everyone. It is indeed a pleasure to be sitting here on this panel today and sharing this space with all these lovely presenters that have gone so far and who will come after me. I'm here to speak about climate change and community safety, and how the lessons that we're learning from the COVID-19 pandemic should really be used to guide the response to the looming climate crisis. I'll also share with you a project I co-led with Dr. Felix Munger, who's the Executive Director of the Canadian Municipal Network on Crime Prevention. And this project was done in partnership with Wilfrid Laurier University's Viessmann Center for Engagement and Research in Sustainability. So to get started today, I'll provide a little bit of a context of the issue of climate change and crime and violence. As many of you community safety practitioners know, and probably have been grappling with over the past year or more, COVID-19 has threatened the safety of people in many communities. We've heard or read reports of various crime and violence directly related to the measures that have been implemented to combat the COVID-19 pandemic. For instance, we've read reports of domestic violence during lockdown at vaccination clinics, as well as some of the other examples that you would see here on the screen. But as I'm sure you're aware from your own work and your own experiences, these reports are neither new nor are they unfamiliar. Yet, we in the communities that we represent still struggle with the responses to this pandemic. What COVID has done, it has reminded us of the many people experiencing higher levels of vulnerabilities to crime and violence. And as we consider these tragic outcomes, the question that one may pose is, what could have been done to prevent these consequences? We must also deal with the knowledge that in a world of rapid global movement, people aren't the only things that are moving. Viruses and diseases travel just as well, which means that it's highly likely in the coming future that we can see another event like COVID-19. Perhaps it's because COVID is still ongoing, or maybe because of the abruptness with which it occurred, that we might tend to consider it an unprecedented event. And perhaps it is on a global scale, at least within our lifetime. However, on a local scale, there are examples of disasters, if you cast your mind back to Hurricane Katrina, for instance, that have brought about community safety challenges with crime and violence outcomes that have seriously affected our communities. I want to share with you this excerpt from a podcast created by our team. And as I read this excerpt, I want you to think about if this sounds familiar. So, in the summer of 1995, a heat wave struck Chicago. A heat wave so hot that it warped train rails and it caused roads to buckle. The heat wave caught both residents and city workers off guard. Hospital and emergency crews were quickly overrun and patches of the power grid failed. By the time it was over, approximately 739 people had lost their lives. And who might these people have been? Sadly, many of the people who died were elderly people who lived alone. They actually chose to stay indoors because the sense of danger on the outside and the fear of leaving their possessions unattended was actually greater than the fear of this heat itself, which makes this a community safety issue. But that wasn't the only community safety issue that was at play. Young residents who lived in communities with very few public spaces that had access to air conditioning, in their desperation to keep cool, they opened more than 3,000 fire hydrants around the city. This actually caused a drop in water pressure, which caused water outages to buildings in the surrounding areas. Imagine, if you will, what the safety repercussions of that would have been had there been a fire outbreak within those communities. Now, to stop them from using the hydrants, the city announced that anyone found tampering with the hydrants would be arrested, effectively criminalizing people who lived in poverty or lived at a socioeconomic status simply because they had no other options to cool down during this dangerous heat wave. And because of this, anger erupted, which eventually led to street violence. And when the emergency crews were dispatched to seal the hydrants, they were met with resistance out of desperation as people threw bricks and rocks to keep them away. When Eric Klingenberg reflects on this occurrence, he refers to the Chicago heat wave as a social disaster. But what does this tell us? Well, just like COVID-19, this story highlights the consequences of poor disaster planning and the impact that it can have on violence, crime, and community safety. But in addition to Eric Klingenberg, there are a few other people who've been thinking about these connections within the context of climate change. And one of those is Robert Muga, who has thought and written about these connections with us from a security perspective. Now, a few years ago, Robert and Felix Munger had a conversation, essentially asking, who else is looking into this potential connection between climate change and community safety, and what is needed? And this conversation eventually led to the idea for an exploratory project titled Mapping the Intersection of Climate Change and Community Safety, which was eventually funded by the Social Sciences and Humanities Research Council and conducted in partnership between Veris Institute and the CMNCP. Now, for this project, we actually brought together over 30 participants from community organizations who represent population groups that experience higher levels of vulnerability or inequality, such as elderly populations, women, indigenous populations. Along with those, we brought together some academics, some safety and security experts, as well as climate change and disaster management practitioners to discuss this issue. And what we really did is we set out to investigate the potential connections between climate change hazards and public safety outcomes at the local and municipal, within the local and municipal context, bearing in mind that more attention has been paid to these potential connections from an international and national security perspective as it relates to climate change. But what we wanted to do is map climate hazards, for instance, coastal flooding, heat waves, droughts, etc., and vulnerabilities with safety outcomes at the local level, thinking about what connections are more likely to occur or what connections are of greater concern. And importantly, we wanted to provide a forum for interdisciplinary stakeholder and expert collaboration to bring greater attention to this challenge. So we actually identified several possible connections during this project. But we also realized that the connection between climate change hazards, for instance, flooding or wildfires, and outcomes like increased property crimes or domestic violence, those connections are actually quite complex. And there's quite a bit of overlap between the various kinds of hazards and the various outcomes that we mapped for the workshop. And I'll give you 2 examples of what we found. The first one is this. Climate change may actually increase social conflict, leading to discrimination, things like discrimination, scapegoating, increased racial tensions, hate crimes, property crimes, or fraudulent crimes. For instance, marginalized groups like Black, Indigenous people of color, or LGBTQ youth, for instance, they face increased exposure to violence and criminalization during and in the aftermath of disasters. During Hurricane Katrina, for instance, there was actually a report from 2 paramedics about a group of mostly Black residents who attempted to cross a bridge into what would be considered a better off community in search of safety after being told that all the shelters within their city were at capacity. And as they approached the bridge to go into this community, they were met by a group of sheriffs who actually fired shots above their head to keep them back away from the bridge. Now, later when asked about this occurrence, the police commissioner actually admitted that it had happened, but he offered the reason that this had happened was that the town that these residents were trying to access, it didn't have enough resources to support the refugees. Now, there's a lot to unpack in this report and the response, but I give this example to highlight how poor and usually racialized communities are left with limited choices due to economic constraints and lack of support, and how this lack of choices actually places them in situations where they're exposed to violence in their pursuit of safety and security. I'll share another quick example for you. And this is about how climate change will actually create the conditions and the opportunities for crime. Now, if you have damaged infrastructure from some kind of natural extreme weather event, that damaged transportation and social infrastructure can actually isolate elders and other vulnerable groups like women and children, as you have seen with COVID as well. And what this does is the decreased access to socialization opportunities actually creates those environments where the type of violence that we're concerned about, elder abuse, domestic violence, and child abuse, where these types of violence may go unnoticed against these vulnerable populations. Out of the exploratory study, we came up with a number of recommendations. The first recommendation is that there's insufficient research and therefore we need to do more. However, I won't go into that today. The second set of recommendations that I actually want to focus on are actually around practice. And right now, there's no single place that a practitioner, be that a climate change or community safety practitioner, there's no single place that they can go to learn more about these connections. And therefore, we're recommending the creation of a repository, some kind of place for anyone who's interested in this topic, in this challenge, that they can go to read and learn more about the links that we started to discuss during our project. We also recommend the creation of a conceptual framework to show how these links, to show the connection between these various factors that might increase safety outcomes because of climate change. The other thing was, it also came to light how siloed climate change and community safety planning actually is. Climate change practitioners doing vulnerability and adaptation planning, they tend to focus on threats to infrastructure and healthcare systems or vulnerable economic sectors, but they don't look at threats to community safety, particularly when we think about the potential for increases in violence and crime. And similarly, those doing community planning, community safety plans, they tend not to think about climate change risks. And what we're therefore saying is that we need to remove these silos and bring these groups together, because there's quite a significant area of overlap in terms of the vulnerability that make populations predisposed for various negative outcomes. And equally as important is the need for an equity lens. We need to keep at the forefront of all planning the importance of paying attention to existing vulnerabilities. And just like COVID-19, those with existing increased vulnerabilities are the ones at increased risk of experiencing negative outcomes. But, rather, despite mitigation efforts, we know climate change is here to stay. And as community safety practitioners, as elected officials, as government staff, we ought to expect similar events in the future, be that more pandemics and more disasters from extreme weather events, directly related to the changes that we're seeing in our climate. And if the evidence is right, Canada will see more wildfires, they'll see more heat events, more flooding, and more supply chain disruptions. And COVID-19 has given us insight into how extreme weather events can and will play out if we aren't properly prepared. Unfortunately, some of the COVID-19 responses place people in unsafe situations, like women during stay-at-home orders, or people in poverty with low-paying jobs that had no choice but to go to work. And therefore, we need to better anticipate these eventualities with the other hazards and with other disasters so that we're not caught off guard again. Because if we don't, the same people will be left behind. And to that end, community safety practitioners need to prepare with a stronger equity lens. As we reflect on COVID-19, data coming out of Toronto reinforces the disproportionate impacts on racialized communities from hazards. And what this means is that community safety practitioners and climate change practitioners need to identify the population groups that will experience higher levels of vulnerability because of existing inequalities that are linked to discriminatory social structures, so that they can create solutions that are responsive to the unique needs of these populations. If our communities are prepared to act, then when these events do occur, and they will, we can respond and recover quicker with less severe consequences for our communities. Finally, we don't want to reinvent the wheels. By that, I mean, there are tools out there that can simply be expanded to use to prepare for these eventualities. And I'm referring to the vulnerability and adaptation assessments used by climate change practitioners and the community safety plans used by community safety practitioners. As I conclude today, if there's one key message that I would want you to take away from this presentation, it is this. Communities need to be better prepared for various types of hazards, like those associated with climate change, from a safety perspective to avoid disastrous outcomes. And this planning should have a strong equity lens to ensure that the people who bear the brunt of these consequences are better prepared than we've done in the past. Thank you. Thank you, Heidi.
Thank you so much, Dr. Springer. Just really eye-opening for me personally. These unprecedented events that we're seeing, whether it's pandemic or due to climate change, absolutely are having negative impact on community safety and well-being. And so you're right. we need to better prepare at the municipal level, all the response, and thinking about safety and how marginalized communities are impacted. And as you say, from an equity lens, so critical. Thank you so much. And finally, our last presenter this afternoon, I would like to ask Erica Baudin to speak for 15 minutes. And we asked Erica to reflect on how COVID-19 has impacted some Indigenous communities and to identify learnings for similar events in the future. Over to you, Erica.
Good morning, everyone. Thank you, Heidi, for the very kind introduction. So I would like to first of all acknowledge and to state to my sister and fellow panelists what an amazing job that you all have done. And I only hope that my presentation meets the standards, and together and cohesively, we've brought learning to the audience for sure. So today, what I've decided to speak about, as you know, contemplation with in contemplation with what the other panelists had talked about, is from an Indigenous perspective, exactly how, from a prairie urban Indigenous reality, how it's going in this global pandemic. So if I could ask Andrea to please go to the first slide. As I've stated, that today what I will be discussing is, you know, the location of Regina, Saskatchewan, but in particular, I do acknowledge that much of the same issues are in Alberta as well as in Manitoba, most closely to the Regina population in terms of percentages, it would be Winnipeg. So, you know, when we talk about that urban Indigenous reality and the historical impacts into contemporary perspectives, who are we talking about? Well, first of all, Indigenous people constitute roughly about 13% of the population of Regina. And what we are estimating is that right now we're just a little bit over 263,000 people in the city of Regina, which has us at about 34,000 Indigenous people. Now, when we say Indigenous people, we are talking about First Nations, Métis, and Inuit. And I'm going to even further break it down to the Indigenous tribes, because the Indigenous tribes are, us as Indigenous people and Indigenous tribes, we're not homogenous. And we have very unique cultures, languages, and traditions. And in and around the city of Regina, or what is now the city, and I would state that we are on Treaty 4 territory, and I am coming to you today with my presentation from Treaty 4 territory. So we have the Cree, the Saulteaux, the Lakota, Nakota, Dakota, and we actually have the unique, I guess the unique way to, we have the only Lakota tribe in all of Canada that belongs to our tribal council, as well as in and around the city of Regina. So in the city of Regina, there's a mixture of people that are just leaving the reserve to generations living in the city. So as I had stated, we're not homogenous. We may have people that have just moved to the city or are coming to the city to see exactly, you know, if it's a better life, to people who have lived generations in the city. For myself, my parents were the first to live in the city. I'm the second. I was raised both on and off reserve. My children were raised off reserve in the city of Regina, actually, and my grandchildren are now, would be considered fourth generation people living in the city of Regina. So although we're connected as Indigenous people back to our homelands and to our First Nations and the communities we come from, very much our cities are becoming our community as well. Socioeconomic status varies for the Indigenous people in Regina, just like I know that it is across the country. Whereas we have people that are very mired and unfortunately very grounded in that poverty lifestyle and mentality, all the way up to what we have in Regina, and I know other cities do as well, an emerging middle class of Indigenous peoples who are, have higher education levels. They not only have jobs, but they have careers, and they contribute to the economic and social prosperity of the city through either themselves and or their families. The other aspect that, when we look at this global pandemic is the fact that, as it's talked about, tribes are very unique. So we are not the same as Indigenous people. Myself, I identify as Naheo as well as Métis. So that for me would be two very distinct cultures. And so you add in my age and my education level, I would be very different than another woman who's sitting beside me, Indigenous woman. And when we look at those historical impacts into contemporary perspectives, we definitely have to look at the cross-sectionality considerations of how we address assisting people through this pandemic. And also, I did want to mention that vulnerabilities can be identified if data is collected and analyzed. And what we have in the city, or not only the city of Regina, but the province of Saskatchewan, is unfortunately there is not a whole lot of data that is specific to indigenous blood or who we identify with as Indigenous people. And so there's people like myself and our nations, as well as other Indigenous organizations across the province, that are feel like we're a little bit behind the eight ball, in the sense that if we had some better data, if it was collected and analyzed, we would be able to analyze it in order to provide better services throughout this pandemic. So I did want to talk a little bit about that. Next slide, please. How did we get here? So, the urban Indigenous experience, and as I said, we're anywhere from one day into the city up to 4 or 5 generations of people, Indigenous people, who would be considered status Indians that belong to a First Nation, and or Métis people that belong to a Métis community, or people who may be marginalized or disconnected from their own community. So we got here, when we talk about those vulnerabilities, through longstanding and current oppressive governmental policies, such as the Indian Act, industrial and residential schools, the child welfare system, the criminal legal system, as well as the lack of relevant services for independence and prosperity. Now, what I'm talking about with the lack of relevant services is that oftentimes, and whether it's for convenience sake or philosophy or belief systems, it's been thought that, and this is back to being homogenous, as in whether it's your socioeconomic status or it's your race or it's your gender or your sexual orientation, a one-size-fits-all approach. And what we have found is that for the urban Indigenous person, the one-size-fits-all absolutely does not fit, and that each case must be treated as unique, even if there are similarities across the board. Those similarities give you, I guess, a bar, and they give you a way to monitor for the lowest level of services to the very unique high services that may be required for an individual. Next slide, please. What are the impacts? So, if we want to talk about the pandemic and the people the urban Indigenous people that require the most services and assistance through this pandemic, we need to look at the impacts of those governmental policies, as well as those systems that have not worked historically or in a contemporary manner for Indigenous people. We have the low education levels, poor health outcomes, physical health outcomes, houselessness. And one of the reasons why, a very dear friend who is now gone on, when we talked about homelessness, what I was told was to never, as an Indigenous person, to never utilize the term homeless, because as the Indigenous people of this nation, of this land, this is our home, regardless if we have shelter or not. And so we consider ourselves houseless as opposed to homeless, because this is our home. These are our lands, whether it's acknowledged by government and the general citizenship. These are our lands. We cannot go anywhere. Therefore, we are houseless. We are not homeless. And when we look at the poverty, and the other impacts are poverty income levels. And so that would be people who are dependent on social assistance programs, disability programs, employment insurance programs. And oftentimes, especially when we move into the generations of people that have those poverty income levels, there become cycles. And those cycles go to the houselessness, the poor health outcomes, the low education levels, the petty crime. But also, while I say poverty crime, I do want to also mention that on the other side, when we talk about the poor mental health and addictions issues, and those become, the chicken and the egg, what we're looking at is those poverty crimes. They then move up to a very, and perhaps a life ending or a life going missing, as what we have seen with the missing and murdered Indigenous women, girls, and two-spirited people. So there are very much impacts for not only the specific Indigenous population and how it affects us as a community of Indigenous people, but anytime you have those low education levels, where you have people on assistance, where you have the health outcomes, where your health systems are very much taxed, the houselessness, where you have people on the streets, especially here in the prairies, where we probably get maximum 4, maybe 5 months, if we're super, super lucky, where a person does not need to be inside a dwelling in order to not freeze, as well as those poverty income levels, where it becomes a lifestyle because they don't know any better to go beyond, or there's no achievements that may be looked at when you have that generations built of poverty income levels and staying within that mentality and staying within, I guess, that socioeconomic status, as well as with the crime, whether it is, breaking into houses or shoplifting food, whatever the case is. The crime is very much an issue that's associated to those historical impacts. And what we have found, and I've heard my sister and brother panelists talk about this, is the impact that the pandemic has had on mental health and addictions issues. It's very much the same for Indigenous people as well, in the city of Regina. And as an agency, much of our efforts have been in the area of assisting, just keeping people alive through addressing mental health and addictions issues. Next slide, please. So how does this relate to the global pandemic and general public safety and wellness? So, what I do have to say, and what I will disclose, is that right now, Regina actually has the highest numbers of vaccination rates for the province of Saskatchewan. As of September 13th, 80% of eligible people have received their first shot, and 74% have become fully vaccinated. And the lowest age range for that, which is 62%, is individuals who are between 18 and 29, going right up to people in their 50s and above that go around the 80% mark. But what we are finding is that for that 18 to 29 age range, that includes Indigenous people. And because of that, our agency is working with the Saskatchewan Health Authority, who are in charge of administering the vaccination or the vaccines in order to raise that level up for that age range for Indigenous people. And so moving on, it relates to the global pandemic because there's less access to harm reduction measures such as sanitization. And with that poverty, many people don't think about this, but it very much is. Many of the people who are houseless and on the streets, they go to areas where there are butts, cigarette butts, or where there's communal drinking or whatever the case is. And so if you're picking butts, you don't know if that might be infected, that butt might be infected. If you're sharing a bottle of alcohol on a chip-in corner, you don't know if somebody else is a carrier or a spreader as well. Many of the people, obviously, if they have money and if you're dealing with addictions and mental health, you don't look for the masks, you don't have the hand sanitizers. And so it's very important for agencies and governments to assist in that manner. Increased personal risk behaviors. We heard a little bit from the police chief, where, those risk behaviors, although crime has gone down, domestic violence as well as elder abuse, family violence has actually increased. Here in Regina, we, as well as in Saskatchewan actually, suicide attempts, completions, overdoses, as well as acute high violence has definitely increased with the longer that the pandemic has happened. Next slide, please. So where do we go from here? First of all, what I would like to say is that collaboration, we cannot do this ourselves, whether it's for First Nations or the general public and the systems, we cannot do it with ourselves. So, there needs to be collaboration with First Nations governments and other mainstream levels of government in order for us to put our heads together and to see exactly how we could reach those gaps and those service delivery gaps, as well as the vaccination gaps, in order to get everybody vaccinated, in order to get people, to keep them alive so that they could so that we could work with people in order for them to see a better day. As well as, and I talked a little bit about this in a previous slide, is that we need targeted pandemic strategies for urban Indigenous people. That includes food security, housing, mental health and addiction services, family support services. And I'm saying whatever it takes. Now, that may sound flippant, but really in this global pandemic, and as an Indigenous agency, as an Indigenous owned and operated agency, where we have a 98% professional Indigenous people serving Indigenous people, what we have found is that it takes creativity, it takes collaboration with each other as well as with other agencies and governments to meet that need, that person's life, so that they could see another day. So whatever it takes is not flippant by all, but what it is a commitment that is needed by agencies or people who are helpers, and agencies that are helpers to do whatever it takes to assist a person to one more day, because every day that we survive is one day closer to the end of this pandemic. Next slide, please. So decolonization versus reconciliation, and I realize I'm going to wrap up here in 2 minutes, but what we have, we hear a lot, especially with Orange Shirt Day and the new holiday, there's a lot of talk about reconciliation, but what I would like to talk a little bit about is decolonization versus reconciliation, which is mostly a government term, unless we ourselves as individuals decide to really investigate that and see exactly what that means to ourselves. So we have the United Nations Declaration of the Rights of Indigenous Peoples, Jordan's Principle, which addresses health inequities for Indigenous children, the calls to action, which are the Truth and Reconciliation calls to action, and the calls to justice, which is the National Inquiry for missing and murdered Indigenous girls, women, children, and two-spirited people. They are all legal imperatives that call on governments to relinquish colonial and mainstream strategies for Indigenous well-being and self-actualization. Authentic Indigenous governments and organizations have the best chance at providing relevant and responsive services to both on and off reserve Indigenous people. So what I mean by that is that with those legal imperatives that are saying that certain strategies, initiatives, especially by mainstream governments, especially by initiatives or funding given to non-Indigenous organizations, do not have the same effectiveness or the long-term success for Indigenous people the way that Indigenous people, Indigenous organizations, Indigenous governments receive in delivering those types of services. We at RITSIS, we have an integrated services model that not only with our agency, but we have a larger tribal council, and we're very fortunate to have this. Whereas, we don't have to put together initiatives where we work with 12 different agencies. We work as the primary case holder for an Indigenous person, and we work with 12 other agencies. And then it becomes a timing issue and different policies, procedures, expectations by the agencies. With our integrated services model and it being an Indigenous model, what we're able to do is address those issues, whatever it takes, and to put together strategies with the individual in order for them to not only stay alive, but to envision that better day. The challenge that I have for the participants today, as well as the panelists, is to research the concept of how decolonization is different than reconciliation, and how you can, and determine how you can be a part of the solution for Indigenous wellness and well-being. So, to me, that whole concept of decolonization versus reconciliation is the key to Indigenous people having self-actualizations, as well as collective actualization. Next slide, please. So lessons learned and moving forward together. No one left behind because, no one can be left behind because we are in a global pandemic that means death and destruction in the fabric of our collective society. So while my conversation today has been about Indigenous people and the cross-sectionality of marginalized Indigenous people, that is specific, but in general, anytime you have a sector of society that is not doing well, that has these vulnerabilities, these gaps, you have a larger society that is not as strong as it could be. So there is definitely opportunity for all of us to support each other in what we have to do to have that strong collective society. Together, we have the opportunity to think outside the current box and methodologies and support different sectors to take the lead in their areas. And so, what that is, we heard about, BIPOC, as well as, I talked about the tribes and the different spirituality, is that we have to have faith. We have to have faith that people are knowledgeable and they do have the answers and they are doing things in the best interests of all, not just their sector, and that we must support each other in that. All strategies created and implemented during this uncertain time will benefit all of us as we move out of this international threat. And, that's one of the things that we have found is that even though we have to think outside the box and we are thinking about things differently, that in actuality, as we move through the fourth wave and hopefully see the end of this pandemic, everything that we've put together and the way we've thought about things and the way that we've put together these strategies and work together, this will all benefit us as we move through this. And, lastly is, I saw the word hope and in the second last presenter. And, we all as helpers and people who live in now what is now Canada, we have to have the faith. We have to have that ability to know that we're going to remain strong and we are going to get through this and be stronger together. So my final message is we will get through this and let's move through it together so that we don't lose any other people and we could get to that place where beyond survival we go to thrive. So thank you very much for listening to my presentation today.
Thank you, Erica, so much. That was a really powerful presentation as well. And I thank you for the work that you're doing every day for to support urban Indigenous people and keeping them alive through this pandemic. As we know, the historical impacts for the Indigenous population have been exacerbated by the pandemic, and your ideas around decolonization versus reconciliation, and the importance of funding Indigenous-led, Indigenous services by and for Indigenous people